Hello everyone. Today we have with us Dr. Ankit Dedhia, who is an interventional cardiologist, and today we are bringing an interesting Facebook live session with him. Today we are going to talk an interesting topic of heart failure.
Hello.
So
Hi,
yes,
Pratik, and hi to all the viewers. I'm glad to be here at Raheja and to discuss something which is very, very challenging and at the same time very interesting.
so as a common man, like we have a lot of doubts and myths about the heart failure, which we hope we can clear a lot of them with Dr. Ankit Dedhia here. So tell me, doctor, like what is exactly heart failure?
Yes, so Pratik, yes, it's one of the most important or rather very challenging topic of heart failure in our day-to-day practice as a cardiologist. Heart failure is something which is very predominantly prevalent and incidence is increasing with so many heart diseases detecting every day-to-day practice, and we see that so many patients are coming with failure and heart failure per se. So what is heart failure? Heart failure, basically heart is a muscle, it's a pump which circulates blood throughout the body, and that's why the failure of that doing so failure of the heart to provide blood circulation to the body or demand supply mismatch. So when the heart uh, is unable to provide the blood to the entire body is when we consider a patient is in failure or patient is in obvious heart failure. So
Okay.
heart failure has been a nemesis for us as cardiologists, and people don't have much idea about it. And I'm glad that we, as cardiology, are practicing it and we are discussing it in open that patients need to know about heart failure in the proper sense.
Yeah. So like a lot of people are usually confused between heart failure and heart attack. So what is exactly the difference between them?
Yes, so glad that you brought that topic out and glad that you got this question on the board, that whether heart failure is equal to heart attack. So no, heart attack is different, heart failure is different. What is a heart attack? A heart attack means when the blood circulation to your heart, see, heart being the most important organ in your body, needs to function 24/7. It needs its own blood circulation, the coronary arteries. Now, when you say a patient gets a heart attack, that is the time when the patient's coronary artery or the blood circulation to the heart itself is getting occluded, whether there's percentage blockage will be 80%, 90%, or many a times we see 100% blockage in the arteries, which we see on coronary angiography, is what a heart attack means. So, heart attack is stoppage or reduction in flow of blood to the working heart. So, that is heart attack. And once the patient has this heart attack, if the patient's heart has become weakened, that results in heart failure. So, heart failure and heart attack are not synonymous, they're not equal to, or they're not the same entity, or they're not just different names of the same thing. But heart attack is reduced circulation to the heart, which can cause death, which can cause catastrophes resulting in reduce in the pumping capacity, which eventually leads into heart failure, where the patient cannot have normal functions of the heart, where the patient cannot do his day-to-day routine practice like walking or climbing stairs or doing day-to-day routine activities. So heart failure is different, heart attack is definitely different.
Okay. And are there any different types of heart failure?
Yes. So heart failure. So when we say what is the normal functioning capacity of the heart? So heart failure is divided into three major types, depending on the pumping capacity of the heart. Now, normal patient's pumping capacity of the heart is 60%, which we call as LV ejection fraction. Now, LV ejection fraction is 60% on a normal patient or in a male or a female. Now, when this 60% is reduced in severity, depending on the severity of reduction, it's divided into three parts. Heart failure has three components. One is reduced ejection fraction heart failure, where the pumping capacity is lesser than 40%. Second
Okay.
is mid-range ejection fraction heart failure, where the pumping capacity is between 40 and 50%. And
Okay.
third is the preserved ejection fraction heart failure patients, where the pumping capacity is preserved, or rather, the pumping capacity is between 50 and or beyond 50. So the heart failure has three types, and it can be divided into these three depending on the LV ejection fraction, which we can get easily on a 2D echo.
Okay. And what are the lifestyle modifications or any daily activity changes that one can make in a case of heart failure?
So yes, so many a times, like I would say, lifestyle modification. Before coming to lifestyle modification, I would like to add one thing, that patients with heart attack and heart failure have different symptoms. Heart
Okay.
failure, heart attack patient may perceive chest pain, heaviness in the chest, breathlessness, uneasy chest pain, which is unbearable. But heart failure patients don't have these symptoms. Heart failure patients are categorically coming with exertional dyspnea, where patients walking or climbing stairs or walking level ground are feeling dyspneic or are breathless, or patient may complain in your clinic saying that, doctor, I am unable to cook food, or I am unable to do basic chores of the house, or I get too much tired on doing so, or I get severe swelling in my legs, which was not there earlier. So, heart failure symptoms and heart attack symptoms are drastically different. As a clinician or as a cardiologist, it's easier for us to know, but the patients who are suffering this are unaware of this. So, that's why knowing these symptoms are important. Coming to your question of lifestyle modifications, yes, lifestyle modification forms the base of treatment in heart failure. And in such situations, we constantly tell the patients to preserve their pumping capacity. Lifestyle modification includes diet. Diet is very important. Fluid restriction is again supremely important. Exercise or physical exertion has to be graded. Stress levels have to be reduced. Smoking completely should be stopped. Alcohol should be curtailed to significant numbers. Again, in diet, also, the salt has to be restricted. Fluid restriction, patient's intake versus output. So, how much urine he passes and how much water or fluid intake he takes have to be matched. Otherwise, what will happen? Suppose, for example, if I take 1 liter of liquids in a day, or maybe 1.5 liters of liquids in a day. On a routine day, I would take 1.5 liters of liquids, including water, tea, coffee, juices, soups, and number of things that we have consumed in a day. So 1.5 liters taken on the first day, and if I don't pass that much urine in a heart failure patient, if I pass only 500 ml, so your 1 liter is retained in your body. Understood. So now this 1 liter will not cause symptoms, because 1 liter in such a big body is not going to be of much significance. You may not have any swelling on the first day itself. But this 1 liter on a daily basis, if you add up for 10 days, that becomes 10 liters. And that 10 liters in one day, in these 10 days, is going to start. So these patients will start having symptoms after 10 days of water retention. Swelling in the feet will start, patient will have breathless, lungs will be wet, they are not able to do their routine. So that is why fluid restriction is important, salt restriction is important. Then nutrition means that calorie content and the protein in the diet has to be proper. Also, when you're considering alcohol and smoking, they are non-negotiable things. Smoking cannot be on table. If you're smoking with heart failure, you are you are going to your doomsday much earlier. And alcohol also causes dilatation of the heart. So have to curtail your alcohol in significant numbers. Also, if you see comorbid conditions like diabetes, blood pressure, cholesterol, thyroid, these parameters have to be kept in real check. These are the lifestyle modifications that we look up to, and managing your stress levels. Mental stress is one big factor which causes more stretch on the heart, more dilatation, increase in the NT-proBNP levels. So you have to make sure that you don't have mental stress, have yoga or de-stress yourself in meditation and all. So these are the basic lifestyle modifications that we consider in our day-to-day practice.
Thank you for explaining in very much detail and everything. And when do you think is the right time for a person with heart failure to see a cardiologist?
So yes, diagnosing the heart failure in the proper way, but what is the cause? See, heart attack is one part of the spectrum which can result into heart failure. So every patient of heart failure does not have a heart attack. There are areas where irregular heart beating or atrial fibrillation, or patient has got a dilated cardiomyopathy where the heart has become huge, or the patient has got an infection in the heart, or has got myocarditis. So heart diseases are a large spectrum of diseases which in all eventuality go towards heart failure if not treated appropriately. So, if you are diagnosed properly with the proper 2D echo, with the proper cause of why the patients had a heart attack, only then you are going to treat it in the righteous sense. So that's why it's important to know the cause, whether the patient has got a heart attack or a dilated cardiomyopathy or an infection of the heart or irregular rhythm. So there are, or a valvular heart disease. Sometimes there's a tight valvular heart, which is are causing severe dilatation of the chambers and which lead to heart failure. So these are certain things which we really should be careful about, and you should consider diagnosing at the right time and then managing. So yes, if you are your regular clinical follow-ups with your cardiologist are important. They will guide you when you should visit, how much water intake, your daily weight should be checked. The weight, if you are gaining weight in the span of 3 to 5 days, that means you're retaining water. Because gaining weight with food is not so fast; it's very gradual. But if you're gaining 5 6 liters in 1 or 2 days or 3 days, then your weight goes up immediately. So all our heart failure patients, we tell them to check their daily weight.
Okay. And is it manageable? Like, what are the necessary management which can be taken into consideration in case of heart failure?
So yes, we are very lucky to have so many drugs or so many medications to manage these heart failure. Basically, heart failure in the reduced ejection fraction category, where the pumping capacity is less than 40%. There are so many good drugs that we have in the pipeline right now, already FDA approved, and we are using it in India itself. And basically, there are 5 pillars of heart failure, uh, where uh, where beta blockers, ARNI or ACE inhibitors, SGLT2 inhibitors, uh, mineral corticoid receptor antagonist, and vericiguat. These 5 form the pillars. But as I said, these heart failure medications should be titrated. They should be started in a lower dose and gradually increased over a period of time, knowing the patient's creatinine, knowing the patient's kidney functions. So you need to really consult your cardiologist to know where you stand in your heart failure management and know the cause. Suppose there is a blockage in your heart, you need to open it up with an angioplasty or a stent, or a bypass is needed. So, knowing the cause, knowing the ailment is very important to treat your heart failure in the righteous way. Only giving medications is not going to work. And management of heart failure does not mean only drug management. Management consists of a team approach by your cardiologist, your diabetologist, your other ailment managing people like endocrinologist who's managing a thyroid issue. All those people come together. It's a heart team approach where your heart failure should be managed in the right way with lifestyle modification, medications, any interventions required like a CRT, or if there's a if there is a discrepancy in your left and the right chamber, it has to be synchronized. So there are a lot of treatment options which your cardiologist will guide you into, and hence we can come to a good, proper conclusion on what is the diagnosis and coming to a proper management strategy for that particular patient.
Okay. So thank you, Dr. Ankit Dedhia, for clearing all the concepts and doubts and myths. I'm sure a lot of us viewers have cleared their doubts about heart failure. And thank you for joining us at Raheja today.
Thank you, Pratik, and I'm glad that Raheja Fortis Associate Hospital is doing so much work towards heart and towards heart failure, blood pressure, so many things that we are discussing here. And if there are any doubts from any of our viewers or any of our patients who really need help with heart failure management, we are here. I'm Dr. Ankit Devia. I'm at Raheja, and I'm always there to help any of our patients who need. Together we can we can succeed in overcoming this big nemesis that we have called
Absolutely.
failure.
Yeah.